Is Daisy's behavior a message in disguise? Let's find out.
What is up, guys? My name is Mavi, and I decided to do my final project on case study IIP10 from Mike Levine and Hall. So Daisy's a 72-year-old female. She has no current diagnosis. She's not on any medications. She has been engaging in a lot of aggression towards her family, nurses, when she's out in public. And her family really wants to know what is going on. So for target behavior, I chose aggression towards others. It is socially significant because it can significantly impact Daisy's quality of life, her relationships, and just overall well-being. The operational definition is any instance where Daisy invades people's personal space to cause harm. This also includes hostile verbal exchanges or verbal attacks towards people. A non-example would be giving her children or grandchildren a hug. So for indirect assessment in ABA, it involves gathering information about a behavior through interviews and other methods. They rely on reports from individuals familiar with the person displaying the behavior, like in Daisy's case, her family members, interviews with the nurses. So her family members state that her aggression's been getting worse. She throws items that belong to the grandkids outside. She yells whenever anyone tries to help her. She snaps her fingers in people's faces when they won't leave her alone. They state feeling unwelcomed whenever they visit her, and collectively they decided to hire a day nurse for Daisy. And for interviewing with the nurse, her nurse says that her aggressions have been increasing. When she engages in aggression, she takes her to a quiet area with her rocking chair by a window, and she speaks to her in a calming voice. Daisy's rude to people, trying to be kind by holding the door open for her when she's in public. But she also it's been 5 years since her last checkup, and she recommends that she visit her doctor. For data collection, I chose event recording, since it's a useful method for tracking how many times a specific behavior occurs within a given time frame. It's also most effective for behaviors with clear beginnings and ends. So like in Daisy's case, her aggressions have a clear onset and offset. I would use this information to see if there's any patterns in the time of day, the settings, the people that are present during each occurrence. This is also a good choice for measurement since her aggressions don't occur at such a high rate when it would be hard to record accurately. Data should be collected for a minimum of 1 hour for 1 week across all adult children, adult grandchildren, and nursing staff. So here's some ABC data that shows the antecedent, the behavior, and the consequence. A lot of times the consequence shows like removal of social engagement. So she's either removed or the children or her grandkids end up leaving. Here is the aggression frequency counting data sheet. And as you can see on the graph, it starts off being variable, but it slowly increases. So based on the graph, I can tell that the behavior usually occurs at home when she's with her kids or her grandkids. There's an ascending baseline, an increasing trend in the behavior. Each time she engages in the behavior in the presence of her kids or her grandkids, they leave or she is taken by a nurse to a quiet and safe place. So it seems that the function may be for escape from social interaction. So some of my behavioral strategies, interventions that I've come up with that I recommend are her having a physical checkup, since she hasn't been to the doctor in like 5 years. Her physician also wants to trial her on some different medications because it sounds like it could be a sign of dementia. These are like could be symptoms of dementia. Also, I want to refer to a psychiatrist for an evaluation. It's very important to examine any medical causes for behavior change before looking at them from a behavioral perspective. I also want to modify environmental stressors, so creating a calm environment, so not all of her family visiting her at once, maybe coming up with a better schedule. And I also want to implement a DRA, or differential reinforcement of alternative behavior, which is a technique to reduce unwanted behaviors by reinforcing a more appropriate alternative behavior, while withholding reinforcement for undesirable ones. I want to conduct a DRA for Daisy. It would include reinforcing a more appropriate request to be left alone, or for some personal space. It would provide more opportunities for her inclusion and socialization. Daisy would be able to interact with people without acting aggressively towards them, and her children, grandchildren will feel welcome to visit her more. This will also improve her quality of life because she won't be feeling so isolated. When Daisy wants to be left alone, she can verbally request to be left alone. She can request personal space without any interruptions. Thank you guys so much for watching.